We're back. How's everyone doing so far with the midday mark? And I want to check in with everyone to make sure you're okay. If you're just joining us, my name is Carmen Mays. I am the founder and CEO of Elevators, and we are hosting this online conference, this virtual summit. And I'm so thankful for one of you who are here, who've been here the whole time, or you just showed up for this. I'm just happy that you're here. We're having a great time so far. A lot of information has been dropped in the chat. So if you're just getting here or need to do some catch up work, you can do that in the chat. Feel free to ask questions. No one's a stranger here. We're all here to help. And if you need any assistance, if you're struggling with something, definitely reach out and let us know. We're here to help. Okay? All right, so let's get started. This session is about healthcare as an entrepreneur. When I was talking with other entrepreneurs, that became a hot topic because we all need healthcare. And considering what's going on, we're in the midst of a health crisis. So healthcare became a very important issue. And so I'm going to talk to you about my journey in healthcare, my journey into getting someone to talk to you about healthcare, and then we can converse with each other, and you can ask me questions and see if we can get some things solved for ourselves today. So my journey in healthcare begins with I've always been insured. So throughout my childhood, I had Blue Cross and Blue Shield insurance. I always, had access to dental, vision, and healthcare. So that not being an issue at all. Even when I worked, so all the way through college and grad school, thanks Obama. So all the way through grad school, I got to be on my parents' insurance. So always had access to healthcare and insurance and high quality healthcare. So when I on my own to be an entrepreneur, I knew I was losing healthcare. But one of my privileges, and I'm very thankful for it, is that I'm a healthy person. I don't have any chronic illnesses, no disease or anything like that. So it wasn't that difficult for me to do anything. And thanks to the Affordable Care Act, preventative care was free anyway. So as long as there was something wrong, or anytime anything went wrong, I could manage it with over-the-counter medicines. That's what I did. So I use a federally qualified healthcare center as my choice for healthcare. There are multiple choices for healthcare, but for me, this one works. It's a sliding pay scale, and they can vary from just a small doctor's office to a more expansive situation that includes a pharmacy, dentist, as well as mental health care, which this particular organization that I use, they have all of that within their organization. So depending on where you are in the country, if you're in the United States, if you're not in the United States, you probably have nationalized health care anyway. Thank you. But if you are in the United States, your federally qualified healthcare centers are a good place to start, particularly if finances are an issue or you want a more affordable type of healthcare. You can attend them if you have chronic disease. They usually have a relationship with a local hospital to help you manage all of those things. So having a chronic illness does not preclude you from using a federally qualified healthcare center. So just do some research if you have when you have some time. Another option is called direct primary care. So this is a little different than what we're used to when we talk about primary care medicine or going to the doctor, to your primary care physician. So this is essentially like Spotify, but medicine. It is subscription-based access to a doctor. So what you're essentially paying for is like you're paying a membership to have access to the doctor to make appointments. It has a there's some space for exclusivity there. So like on the higher ranges, you can essentially like have like almost concierge service. But there are some more affordable ranges or more affordable ranges where you can, for like 50, 60, $70 a month, you can essentially have access to a doctor. You make an appointment. It's not like the waiting around, like in normal services where you call, you make an appointment, and then you wait, and then you wait, and you wait, and then you go. Direct primary care's whole model is really about reducing the amount of time you spend at the doctor, but increasing the quality time that you do spend with the doctor. So you get to build a relationship with your doctor. Upfront what all your costs are going to be. There are no surprise costs. And it is a model that is being propagated throughout the country. It is a very popular model. They have their own association that's lobbying to make costs associated with direct primary care tax deductible. So it's definitely a model that is picking up steam. And if you want a more affordable and familiar system, then I would suggest direct primary care. The oldie but goodie is, private insurance. If your state did not expand Medicaid, my home state did not, there are some gaps in the system, but definitely the thoughts around getting an individual healthcare plan vary depending on what state you're in, and they definitely vary by cost. Now, unfortunately, HHS, Health and Human Services, have not open enrollment for the COVID-19 crisis. So you have experienced a qualifying event, which COVID-19 does not count for, just to let you know. Unless you've experienced a qualified event, you actually can't enroll in that kind of healthcare at the moment. So your options are going to be more direct primary care or a federally qualified healthcare center. Now, it is said that, according to HHS, to accommodate people who are uninsured and who end up contracting COVID-19 and have to cover those costs. But if you're just out here being regular sick, you on your own, okay? Just want to let you know. So those are some options around healthcare that I found when I was researching about what I needed to do based on what my health situation was and what I could afford to do. And so I settled on federally qualified healthcare. You may find that direct primary care is better for you, or you may feel that you need a traditional insurance plan. And when open enrollment is back open in the fall, you've experienced a event, which you can find on the HHS website, then by all means sign up if you can afford it. Okay. Also, some other things I learned or that I've used. Telemedicine. So telemedicine is this overlay component that is accessible in all areas on the socioeconomic spectrum. You can telehealth to a federally qualified healthcare center, telehealth to direct primary care, telehealth to your regular doctor. Some hospitals use it as a cost-saving mechanism for their indigent care systems, and some people use it as concierge doctoring. But telemedicine is an option if you have access to technology, and you can find a doctor at any time of the day. Some services make sure that there's a doctor or a nurse practitioner or even a nurse available 24 hours a day. So definitely look into telehealth either through your service provider or just as a standalone. There are some straight up just by themselves telehealth situations. Telehealth has become increasingly important because of COVID-19, because they don't want folks going to the ER. They don't want you to show up to the doctor talking about you got a highly contagious disease. They want you to stay in your car and they want you to call in. Um, so telemedicine has been used more often. Um, be sure that you are using the using a HIPAA certified telemedicine service. So your rights are protected. But as long as you have that intact, I will definitely in times like this always, always, always opt for telemedicine first. Call ahead first, because all the sick people at the doctor, and you don't want to go in there and get sick or even more sick than you already are. So definitely want to take a look at that. There's also another designation called the patient. I lost myself. Here it is. Patient-centered health, patient-centered medical home health. So this is a designation that a healthcare provider can get through Department of Health and Human Services, and it has 5 functional attributes. One is comprehensive care. So they any of these places, they manage all of your health from physical and mental. They do prevention and wellness, acute and chronic. So the federally qualified healthcare center that I use is also certified in PCMH, which means that's why they have holistic healthcare, it's patient centered. I'm overly informed. And it covers everything. There are all types of programming, from, like I said, there's pharmacy, you can get a dietitian, you can almost anything can almost happen there. It is a very comprehensive situation. So if you are a person who needs a more end-to-end health care option, definitely look for something that's PCMH. Because that's what that means. That means that they are all encompassing a comprehensive care center. It's also patient centered. So there's a lot of work to be culturally competent. There's a lot of work on, understanding, reading the room, understanding where you are, providing language services, interpretation services, speaking and using language that most people understand, even if they don't have a lot of education, things like that. If those things are important to you, definitely look up that kind of place. Coordinated care means that they are a part of the broader healthcare system, which means that these are not standalone clinics. They work together with each other and with hospitals and other healthcare providers in the community to make sure that there's a continuum of care, that they're sharing information. It's also accessible. So they do manage their scheduling a lot better than traditional places where you're waiting a lot. It's shorter waiting times, prioritization over urgency, to somebody somehow. It's very accessible, accessible healthcare, and it's high quality and safety oriented. So you get high quality care, just like you would if you were going to a doctor who only accepted private insurance. And like I said, the organization that I use is a federally qualified healthcare center, and it is also certified in patient-centered medical home. And so I actually really enjoy it, and it's a very positive experience for me, because they really live up to those values. So those are those are the things that I have learned so far in figuring out how to navigate healthcare, as a self-employed person, as an entrepreneur, particularly in COVID-19. Obviously, if you live in a different kind of state than I do, your resources are, there's places like the Freelancers Union, which functions like a union for gig economy workers and other freelancers, and they offer group programs for dental and health insurance. There's also apps out there, where you can access healthcare, access doctors, access birth control, excuse me, there is another startup called Prinnovate. I had the pleasure of meeting their founder years and years ago when they were going through a health tech accelerator. And they're all about helping people who have chronic illnesses manage their diets. So you can sign up as an individual, or your healthcare provider can sign you up. And based on your information around what illnesses you have or you are on your way to having, they can suggest dietary hacks for you. You get meals and things like that. There are also startups providing healthcare. The health tech space is very interesting. A lot of it is obviously geared towards like that, or really more a B2B kind of situation for doctors' offices to function in a certain way. But more and more B2C, business to customer integrations are coming on to help people manage their healthcare as well as access healthcare. Okay, I'm going to have a comment. AIGA offers health insurance if you are a member of a local club. Here is Birmingham chapter if you want more information. Thank you, Tiffany. Definitely check out that link. If you have any more tips or hacks, the chat. Another tip is GoodRx. I use GoodRx. I have one prescription, and it's an allergy medicine because the inside of my face don't work good. Beautiful on the outside though, beautiful face, but the inside is just, it don't work. So I have an allergy medicine that is prescription only, but through GoodRx, I can afford it. So GoodRx is also a good program if you don't have prescription coverage with your insurance, or you don't have insurance. Using GoodRx will definitely help you out in the price area. CVS and Winn-Dixie are usually the cheapest, sometimes Kroger. But definitely look into GoodRx if you are looking for ways to have cheaper prescriptions. So putting this talk together. So the reason that I'm talking to you as opposed to someone else who's well-versed in healthcare policy is that apparently this is not being talked about. So this is really an opportunity for us who are affected by this to really speak up, because when I was calling around, and I called people who were in public health. I called people who were in healthcare advocacy. I called people who were actual physicians. I called all kinds of people, and nobody could really give a broad understanding of what it was really like if you were an uninsured person in this country, or you were in the gig economy, or you're an entrepreneur or a freelancer. Nobody could really felt comfortable producing a talk about that. And which means to me that it's not being talked about. This is a question that apparently has not come up. A lot of people thought it was solved with Obamacare. Clearly it is not. Particularly if you are a millennial, we are moving into our second recession of adulthood. Things are different. Things are very different. And so I definitely want to leave space for you guys to talk back to me about what you're doing, what you're using, how you're managing your health, your mental health, visual, physical, dental health. Let's talk about, what solutions we can come up with. And in the future, we'll have an actual talk where we can hopefully get some elected officials or representatives from elected officials on to talk about healthcare wise what we need and what we need advocating for. Okay, Ariel wants to know suggestions on dentists in particular. I don't have a dentist in particular, but what I do know is that some dentists are also moving kind of to that direct primary care model where you pay a monthly fee or whatever, and you get this list of services from them. So I don't know one particular, but I do know that is available. That you'll probably have to call around and see. I don't think that there'll be. I think it's becoming more and more popular. So, and if they don't, if you have a dentist that you like, because finding a good dentist is like up there with finding like a good hairdresser. And if you can find you a good dentist, pitch it to them. Say, hey, I like the way you do dentistry. However, this is my circumstance. What can we work out? If I pay you $50 a month, $75 a month, will it cover 2 cleanings a year, some X-rays, or whatever basic dental coverage is? Do some research and pitch it to a dentist. We are in unprecedented times. They need money too, and because ain't nobody going to the dentist either. So I think this is definitely a good time for you to be entrepreneurial, even about your healthcare. Um, if you know, I care the same way. When you get off into specialties like dermatology or cardiology, I know those are not like equal. Um, Oncology, things like that. Then we're talking about a more complicated working together of things of just primary of traditional insurance. But if you are relatively healthy, um, you can piece it together. Yes, some insurance. Good gems from Tiffany about supplemental insurance. Um, and how you just have to. Sometimes we have to make we have to make what we need because it doesn't exist yet. And so that's really what we're dealing with. What we need. Well, what we need does exist, but this is not a political. I'm not. What we need exists. We just don't have it. But particularly in states who have not upgraded Medicare. Um, yes, Birmingham Healthcare has a sliding scale for dentistry. The Foundry in Birmingham also does dental work. They actually do some oral surgery. They do some extractions and implants as well at the Foundry in Bessemer. If you're in the Birmingham area, you can find them there. Anybody else have any tips or tricks or thoughts around healthcare as an entrepreneur? Um, Things that you have found, obstacles that you have experienced, things you wish you would have known? I have not heard much about the faith-based health share plans. Um, but the share plans, they are popular in thought, but I haven't really seen one executed yet. Outside the traditional like group purchase policy model. In addition to faith-based places, like co-working spaces, also try that out. Um, to be able to offer that to their members, but I have yet to really see it executed very well. Um, so no, I haven't. Um, I haven't seen it, but I'm definitely going to look into it, Lisa, to see what I can find about faith-based health share plans. Um, to see if that's something. Tiffany says VSP also has eye care plans for so it's $10. Again, if you're in the Birmingham area, there's a link for that as well. You're welcome, Lisa. So we have any more thoughts? Does everyone feel healthy? Is there anyone who is not feeling well that we need to um, kind of rally around, or is there a problem we need to swarm on? Um, Something that you're looking for in particular that we can try to help with? Pardon me, I'm thirsty. Any thoughts? Anybody having any issues? Know of any other hacks? Any favorite apps that you use for healthcare? Like I said, I'm a big GoodRx fan. Of course, there are a slew of apps around, like I said, birth control, mental health, all kinds of things like that. Okay. Well, definitely be on the lookout for subsequent talks around healthcare and entrepreneurship, and be thinking about the policies that you would like instituted or the policies that you would recommend, programming that you would recommend, because I'm going to definitely pull this together, um, because y'all, like for weeks, yes, I would definitely, for weeks, I was emailing and calling and cold tweeting trying to find just trying to find folks, and the people who were probably most able to help can't help because they actually working at the hospital right now, and they're very busy, but this is really something that has apparently not really been on the radar. This is not something that people are really talking about, when it comes to like the practicalness of like, I don't feel good today. What do I do if I don't have insurance? Um, and so some of that is a marketing problem. Yes, Cahaba Valley Healthcare. Am I Cahaba Valley? What's the one? I think I go to Cahaba Valley too in West End. But like people don't know what to do. Like people don't know what to do. And I think there's also, um, on one end, these services are really intended for people who are lower income. Well, consequently, a lot of entrepreneurs, particularly when you're starting out, you low income too, and so there hasn't been a lot of bridging, um, of these services and promoting themselves as tools for entrepreneurs. Like, yes, we know that we are, um, stylized, informed because of this. But if you're an entrepreneur and you also fit these requirements, like you can come here too and making this an option. So I'm definitely looking forward to put that together. If you're interested in being a part, shoot me a message or an email and let me know. That'll be coming up sometime probably in the next couple weeks, since we just have so much time on our hands now. But definitely looking for, helping people just identify the different types of healthcare options there are. If you have to have some sort of insurance, what that looks like, what that means, what your options are, what tech options are for you. So like I'm really interested in really bringing, information and innovation around the way entrepreneurs access healthcare, because apparently nobody really talks about it. And it's up to us as creative entrepreneurs to create the things that we need. So, thanks, Brian. Yes. Thanks, Brian. And thanks, Tiffany. Yeah, Kahama Healthcare is a good, one if you're local to the Birmingham area. Well, guys, I have really, really appreciated it. Again, if you have any questions, thoughts, or concerns around healthcare, things that you would like to see in a healthcare forum as it relates to entrepreneurs, please let me know. I've already been working on it. Everybody who's been like, I would, but I was like, save the date because we um we gonna need to talk about this because this is serious. Um, and we're not getting much help from the government. So definitely going to want to talk about this. So if you're interested, definitely shoot me a message, shoot me an email, and we will get to planning. All right. Cool. Yes, UAB has a free clinic. Another thing, I thank you for writing that. If you live in an area where there is a medical school or a dental school, um, there's definitely opportunities to get healthcare through medical, dental, and ophthalmology schools. I have been down to the Eye Foundation many times. Well, not many times, a few times. There's UAB School of Dentistry in the Birmingham area. So wherever you are, if there is a medical institution teaching, they also have clinics as well. And if you're here in the Birmingham area, Cooper Green is apparently still open. And definitely reach out to your local health departments if you need anything. That's what they're there for, is to answer your questions. That's why you pay your taxes. And always, in the case of emergency, call 911. Even in times like now, I know people are adverse to calling that. We don't want you to go to the hospital, but do call the 911 if you need help. Don't let this current health crisis prevent you from accessing the healthcare that we do have access to. So definitely do that. Please stay well, eat well, get some exercise and some sunlight. We're going to be doing the best we can as individuals. Happy birthday, Tiffany. Okay. Yeah, happy birthday, Tiffany. Today is also Tiambe's birthday, the woman who was on before me. So it's a lot of birthdays. Happy birthday, y'all. But yes, if it's a non-emergency, go to Cooper Green Urgency Care. Oh, there you go. If you're in the Birmingham area, you can go straight there. Or if you can get to the Birmingham area, you can head over to Cooper Green for a service, because Cooper Green is still open. I'm going to have to get Sheila Tyson on my healthcare panel. That's going to be fun. All right, y'all. That's my time. I really appreciated it. I hope I've shared something with you that was useful and helpful. This is just my journey in healthcare that I have been able to piece together to meet all of my needs. I really wished I could have had like this dynamic panel, but as I stated earlier, this is a topic that really hasn't been well thought out, and people really haven't settled on what to do, particularly since healthcare varies by state to state. It's just people just don't know, like they don't know what to do. So in navigating this new paradigm, I'm more than happy to admit when it's really just a question mark. I wanted to provide answers, but sometimes all we have is question marks until we create the answers. So again, thank you for your attention. Thank you for your time. Be back here at the top of the hour for our next session with Reginald Smith. And you're going to be talking about banking and loans and things like that, and how banking is actually different for people who are self-employed. So thank you again. Thank you, Miss Lisa. Thank you again, and I will see y'all real soon. I'm going to try to sneak in a sandwich before I have to come back home. So thank you again, and I'll see you real soon. Bye.